loses. In fact, it's one of the most dangerous seizures because it can lead to head injuries. It can lead to, you can fall anywhere. It can fall as the child can fall. The thing can fall as he's crossing the road. It can fall as he's operating a machine. So the body just generally loses tone of the muscles. That's the muscles just become flaccid, and the person drops. In fact, I think that's what's called drop attack. Self, person just falls. Then we have atonic. We have atonic myoclonic seizure. Myoclonic atonic seizure. The patient jerks and then becomes flaccid suddenly. Then the next one we have is a post-ictal seizure, that's after the seizure. We have what we call post-ictal amnesia. It can be one of the things that's happening to these people, because the man they are complaining that they will not remember anything. So during that post-ictal phase, if maybe you met your apprentice during the post-ictal phase, whatever you are saying, he won't understand because he's still trying to recover. That can be part of the things that's happening to these people. Next one is thought paralysis. Maybe you met him after the seizure during the post-ictal phase, and part of the body is not working. You now say the child is demon. Yes, they were also saying they were demon possessed. You now say the child is demon possessed because one of the part of the body is not moving very, very well. You now say this child is likely possessed. So those are the things, those are the problems these kids might be coming down with, and people were calling them. People were saying they are stubborn. Okay, now so what are the likely ways we can get conditions that can cause this in that home? Most of the things causing this seizure, these children, are from their masters. Let me list them for you. Sleep deprivation. Most masters are so cruel, or their work is so tedious that they deprive this apprentice from sleeping. Next one is excessive stress. Infections, poorly treated diseases, poorly treated fever, decreased oxygen, excessive playing of video games, sounds that are repetitive sounds, low sugar, maybe they're not being fed very well. If the person is taking drugs, maybe hypertensive drugs. If the person is abusing drugs, if there's head injuries, or if the person is abusing alcohol, all these things can lead to seizure. Then the next one is how do we help these people? So these are the things that will help a doctor, and also help any caregiver, any health caregiver, to manage any of your apprentices that is coming down with these diseases. So these are the things you should find out. So because the questions I'll be asking you is, how fast did the episode start? Did it start abruptly, or did it take a while? Was the patient exhibiting some kind of characters before the seizure started? Was there any abnormal body movement? Was the patient's body moving anyhow? Was there checking, all those stuffs? Or was there any abnormal behavior, like staring into the sky, all those stuffs? How long did that episode, that seizure, one singular of the seizure episode last? Was it less than 30 seconds, greater than 30 seconds? How quickly was the recovery? Did the patient recover immediately after the seizure with no post-ictal phase, or was there series of events during the seizure? Then the questions I will expect you to find out from the patient, because these are questions I'll still ask the patient, that is your apprentice, is: was there a premonition or warning, like aura? Was there a trigger? Remember we said epilepsy has no trigger, while non-epileptics have triggers. Was the trigger like flashing of light or repetitive sounds? Was the child ever had meningitis or any kind of brain infection before? Was the child into use of drugs? Is the child being managed for seizure before but refused to take his drugs? Is there family history of seizures? Then we'll go into blood tests. We'll do some little blood tests, check the level of the drugs, if the patient has been taking drugs, whether the level is okay, and check whether there is any other infection, all those things. You can even also do lumbar puncture if you're suspecting about brain infection. Then we can place the child on some drugs, and it's important. We can, in some cases, we can also write, put like a bracelet, so that if something like that happens, people will know that this is this. Then, as a medical doctor, whenever a child is having seizure, the child needs your help. Whenever you discover any abnormal behavior in the child, don't beat the child, don't hit the child. Be very observant of any child around you. What do you do if if it's not a generalized seizure? Calmly help the person sit down or lie down, so that the person takes time, recovers. If there's generalized seizure, protect the child's head. Don't put your hand inside the child's mouth. And then turn the child immediately. The seizure stops. Turn the patient into a recovery position. Lie on the left and allow, so that the patient breathes very, very well. Don't be hitting the child. Don't be praying don't be punching the child. Don't start pouring holy oil into the child's mouth. Then when you now come to hospital, we administer some drugs and medication. So seizure is not really that. Seizure can appear very scary, but it's very, very easy to manage, and people rarely die from it. Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treater, the Blue Pools Day.